مساء الخير. أهلا بكم جميعا في هذه الأمسية من Our Psychiatric Journal Club. يسرني أن يكون ضيفنا اليوم الأستاذ الدكتور أيمن منصور، أستاذ التمريض النفسي في الجامعة الأردنية، وعنوان الورقة Psychological Predictors of Psychopathy Personality Among University Students، وهي ورقة من إعداد. تفضل دكتور أيمن.
السلام عليكم جميعا. شكرا دكتور وليد على هذه الأفكار الجميلة، إن نتبادل مع بعض الأفكار البحثية والعمل البحثي، وإن شاء الله يكون في تعاون في كل المجالات بإذن الله.
تفضل.
بس أتأكد من البرزنتيشن. ظاهر البرزنتيشن صحيح؟
ظاهرة مش فول سكرين.
نعم. طيب, the topic for tonight is about psychological predictors of psychopathy personality among university students. Actually, the idea came because of many of the questions around why university students could be or probably suffering from psychological problems. I have examined many factors among university students and young adults in general, including also the high school students. We examined before the anxiety, depression, some kind of things related to daily hassles, including substance use and so on. But during the past 5 years, I noticed and observed university students doing certain kind of behaviors that seems to be corrupted, or we can say it is life sense of harming self in any way. So when I examined the suicidality among the university students, I could not actually find what I want. So I decided that probably the issue could be in personality rather than being in the psychological status of these individuals. Therefore, I considered the issue of psychopathy personality rather than being a disorder. It's not like having or examining these individuals as somebody sick with the disorder of psychopathy. It is only having a traits of psychopathy. So at the beginning, disrupted personality is one of the defining features of a student's mental health crisis. And this is exactly what one of the things that I have observed. And personality identity is formed based on the collective personal experiences. And that's why, because of the issues related to maladaptation and being at high risk for several disturbances in mental health, as I said, including depression, anxiety, substance use, anger, and aggression itself. So, identifying the process among these students would somehow influence their life and influence their way of management of their life as students. And the most important part is the academic motivation and academic performance. So I thought that these people, if they are suffering during their university life, which sometimes we call it the perception of schooling or the university life in general, and being at high level of psychological disturbances such as the academic burnout and academic anxiety, academic stress, these people probably will have personality issue. Therefore, this study actually trying to emphasize the importance of examining psychopathy personality traits among university students and how it is actually influencing the academic performance, which is the most known and the most prominent kind of function among these students. We do not know that much about such kind of topic in the literature, especially and particularly among the Arabian students. Why? Because of the different kind of culture and perception and understanding of what is psychopathy among these people. Usually, we mix between aggression and anger, anxiety expressions, and depression expressions as part of the psychopathy personality. We know that anger and anxiety has been examined frequently in the literature. However, we do not know whether psychopathy personality would be a factor that may influence in certain way being a dependent factor or being independent from depression and anger and anxiety. And that's why I thought that why not examine anger and anxiety and depression among these students? Why not? But the question, if I examine these factors, do I have any kind of evidence to connect these factors to psychopathy personality that could somehow be masked by anger expression, anxiety expression, and depression? So, in general, the perception of psychological well being and wellness may indicate a probability that certain kind of behaviors could be psychopathic due to negative perception, which means that I could mask the anger, depression, and anxiety and depression without being noticing or notifying or even observing or even identifying factors that could be part of the psychopathy personality. And this is the reason behind doing this study. We're not trying to somehow identify university students being psychologically disturbed. Rather than having such kind of a trait will increase the probability of having further psychological problems that could be somehow affecting their academic performance. Therefore, the purpose of this study was to examine whether anger, depression, psychological well being, which are the factors that we usually examined, could predict psychopathy personality traits in general among non-clinical sample of university students in Jordan. When I say non-clinical, means these people never been examined or assessed or even complained of having any problems with personality or identity. So they seems to be normal to the people and normally behaving among in front of others and normally living with other people and just only focusing on the minimal things or minor things related to personality and behaviors. So what I did is that I took this kind of option and tried to examine these factors as predictors for psychopathy personality. And this study actually done among university students using online survey, focusing on the four variables, as I said, psychopathy, anger, psychological well-being, and anxiety. So before I move to the results, I would like to just mention how is it different when you talk about psychopathy personality than talking about psychopathy as a disorder. So from perspective of anxiety level, there are like two kinds of psychopathy personality, the primary one and the secondary one. And let me say that we are, as academicians in general in the field, we are observing the students. And we know that see certain kind of behaviors and expressions by the students actually could relate to such kind of topic. For example, when we say primary psychopathy, you will find a student who have low level of anxiety. He is controlled or flat with emotional kind of regulation. The risk taking is strategic, which means you won't be able to identify these kind of behaviors or risk taking behaviors. When we talk about antisocial behaviors, it's more controlled. Therefore, you won't be able to identify that student in any way that he is doing something harmful or remorsing or whatever. And you'll find things like superficial charm, grandiose sense of self, and emotional sometimes, and tendency to manipulate others. And manipulation will be a kind of a smart game. But those who seems to be more apparent and noticed by the academics in general, the students who looks at least expressing high level of anxiety, he is unable to regulate his emotion, he is highly impulsive, He's making decisions before he's even thinking. He's more erratic and violent, and that's why he's involved in many quarrels and fights. And probably he will have many kind of let's say warnings and punitive things because of these mistakes. And also you will find him with kind of mood swing. That's why sometimes those who are suffering from secondary psychopathy miss understood as part of bipolar, or depending on the situation, seasonal affective. Sometimes you will call because of the weather or because of the context, exams, or whatsoever. Poor impulsive control, high risk for substance use, and antisocial. So probably we will see the people with secondary psychopathy frequently more than the primary psychopathy. But both are considered part of psychopathy personality that seems to be connected with further psychological problems, including that ones that seems to be very harmful to self and other. So what did we find? We find that those with primary psychopathy, the highest level, what the highest percentage was with the primary psychopathy. But when we look at the medium level and the high level, which we call it high risk for psychopathy, it was like 0.5%, which is something like, as I said, we won't be able to identify these people because people will not see the signs and symptoms of primary psychopathy as a problem rather than a social issue or an interpersonal kind of conflict. But when we looked at the secondary psychopathy, it was more apparent. We have like 51% of the students in this study who was actually classified as primary secondary psychopathy at the medium level. More serious is the one that has high risk, and we could meet the criteria for psychopathy in up to 1.6%. So I'm going back a little bit to this slide and just reminding you that these are the signs of the secondary psychopathy, which is something like very harmful and serious. He is someone who is able to injure or harm others and harm himself. And we are not talking about the percentage as 1.6 as a small figure. It is harmful. And once we are talking about the students in general, and we take like a convenient sample, what if we took larger sample size and we included more students and we targeted students with problem? This is one of the limitations of the study, in which we can say that we may include and exclude students who actually suffering from psychological problems or being diagnosed with psychiatric illness or having family history with psychiatric illness and so on. So these people are considered healthy to the people. These are healthy students, normal students, and still we can find up to 70% of these students classified as medium to high risk for psychopathy, secondary psychopathy personality traits. Going to the other variables like anger, and we can see that anger in general has a medium of 12.8, talking about the percentile about 12, and that's kind of medium level. So they have like moderate level of anger. All in all, the well-being was much similar to anger. But when we talk about anxiety using JAD, the numbers were somehow different. We're moving to moderate to high level of anxiety, which actually corresponds with our understanding that secondary psychopathy connects and can be somehow notified or identified through a high level of anxiety and inability to regulate their feelings. Now, moving to the regression and differences, at the beginning, we can see males and females, and it is significant. And the mean for the primary psychopathy was almost close to female, but it is somehow larger. The mean is higher in females than males to the secondary psychopathy, and that is something shocking to me. I thought at the beginning that I will find a high mean score for males compared to females, but it came out like 24.2% compared to 23.4% for the males. Although the figure is not that much different, but statistically it was different. Now we're speaking about clinical difference compared to statistical difference. In relation to the other factors like medical diseases or having psychiatric diseases or taking psychotropic medication whatsoever or on sleep aids or even smoking, there was like no kind of differences except on the primary psychopathy, which actually, if we go back to the slides where the primary and secondary, we can say that these people, the primary psychopathy people, having more tendency toward using substances, which is somehow contrasting the idea of being on substance use as a secondary psychopathy. It seems that primary psychopathy, who are the cluster that using substances rather than, and the difference was somehow much larger than the difference between the male and female in smoking, 30 point compared to 28.2 and 24.2 to 23.9, which is something need to be addressed. Now moving to the regression, and that's the academic and physical, we can say that there was say, most, that it was known and very expected to find differences in the academic level, because we said at the beginning we are expecting to find differences in the academic performance, and that was significantly high, and the physical well-being was also high, and the mental well-being was also high. This mental well-being means the perception of mental well-being. We asked the students, how do you perceive your mental well-being? And we asked them to classify that from poor to excellent. Poor, fair, good, very good, excellent. But with the secondary psychopathy, it's only the academic level, and those with physical well-being and mental well-being was not. And in the academic level, the difference was between those at the year one, first year, the juniors, and the only students in the first year compared to those in the fifth year or above. Now moving to the regression and whether we could predict primary and secondary psychopathy out of the psychological factors that we mentioned: anger, anxiety, and psychological well-being, controlling for social, demographic, and health related factor. And this is the primary psychopathy. We found that the academic year was a significant predictor. So the students, so similar to that one in this slide, the academic level was a significant, making the significant difference in the expressions of primary and secondary psychopathy, which means that students in the first year compared to those on fourth and the fifth year is less. It means that students, when they are getting more mature, moving from year 1 to 2 to 3 to 4 to 5, they are being more in control of their psychological expressions and less to have the traits of primary and secondary psychopathy. At the same level, perception of mental well-being. Confirming our hypothesis, anger was a significant predictor of primary psychopathy and psychological well-being. I was astonished to find that anxiety was not a predictor, which means that we cannot predict primary psychopathy out of anxiety. And that was astonishing to me, but it corresponds with the theory. Why? Because we know that primary psychopathy will never show their anxiety and they will never feel anxious. Those who are highly anxious, those are the secondary psychopathy, not the primary ones. So when we predicted and we decided to predict primary psychopathy out of psychological factors, anger and psychological well-being were the factors that need to be emphasized. Moving to the secondary psychopathy, it's only anger. Second, the anxiety and psychological well-being were not at the same level. We kept the mental well-being, the academic year, and gender, the sex as the factors that are actually also making difference and considered a risk factor for psychopathy, which is the primary one. So, what do we conclude? We know that 6.7% and 0.5% endorse symptoms consistent with medium risk and high risk primary psychopathy, which is more likely to be less rational and anxious and do not possess an interpersonal charm. But when we consider the secondary psychopathy, we have typos here. We have the Y. 19% endorsed statement consistent with high level or risk of psychopathy, and 1.6% endorsed statement consistent with high level of psychopathy. This means these people are prone to destructive behaviors, have increased reactivity, have moderate to high level of impulsivity, and are somehow unable to control their emotion. So when I say about the fights that happens at the universities, sometimes it's not because of the anger or frustration or depression or academic performance. It could be because of the secondary psychopathy personality traits they have. As I said, it's almost like 60% of these people are suffering from medium to high, and 21% of these people are very high in these traits. This is dangerous. Actually, to me, as someone in the field of research and in the field of mental health, I consider that as a very serious kind of note. Anger, psychological well being, and anxiety were factors that need to be addressed. Anger is the most important factor to be addressed when we examine primary and secondary psychopathy traits. Psychological well being comes second. Anxiety was not there among the Jordanian students in this study. In conclusion, psychopathy personality among university students need to be detected and assessed and need to be addressed among healthcare professionals, mental health professionals, counselors at the universities, and even at the high school. And this kind of thing need to be addressed in terms of psychological assessment, which need to be periodically and need to be planned. And we need to focus on the factors that could predict the primary and secondary psychopathy traits, including anger, perception of psychological well being, perception of physical well being, and in general, anxiety. We need to have larger sample size, and we need to check on students who actually been involved in aggression or anger acts, and to find out more about how these students actually manage and adapt with their anger, frustration, and what kind of feelings they have once they have this kind of expression that seems to be harmful and they are not aware of it. This is simply like certain kind of recommendation and conclusion. I consider that the most important factor that need to be addressed, that the socio-demographic factors, including sex, where female seems to be high in secondary hypothesis, secondary psychopathy compared to primary psychopathy. Also, the first year students, these people are coming to the university unequipped with skills that enables them to manage their psychological frustration. They lack skills related to social adaptability. They lack skills related to high load of academic kind of work. Probably students in the health sciences, they are feeling overwhelmed and psychological disturbed because of the over requirement. Therefore, we need certain kind of counseling. At least there should be certain counseling sessions for these students, or at least providing them with courses that enables them to manage their psychological needs in the first year. As we find out, these students in the first year are much more at risk for primary and secondary psychopathy personality traits that involves harmful to self and others. And in conclusion, which is in general, I can say, what do I need to recommend? Developing and proposing psychological interventions, programs focusing on anger and anxiety management, enhancing or improving psychological well-being as part of routine psychological counseling. There should be sex-sensitive approach of psychological counseling that seems to be more focusing on females rather than males. And I'm not saying that we should focus only on females. I'm saying we should not ignore or somehow assume that males are more aggressive, more angry. No, we find out that even female are suffering from anger, frustration, aggression that seems to be somehow notified and um, being identified with high rates of secondary psychopathy personality traits. That's almost everything for today. I made my presentation short so to allow you to give you more chance for questions and hope that we can have the answers because I know this topic needs a lot of work and things to be done. Inshallah.
شكرا شكرا جزيلا دكتور أيمن. يعني هذا موضوع مثير للإعجاب والدهشة. يعني أعتقد برضو لابد من التوضيح أن المفهوم عند الدارسين والعاملين وأن هناك يعني psycho antisocial personality disorder. But this is not really what you are talking about. The
صحيح.
full criteria of antisocial personality
No.
disorder.
Yes.
فهذا بده أعتقد توضيح لأنه شوية يعني كان.
صحيح. احنا ما بنقيس البيرسوناليتي لا انتي سوشيال بيرسوناليتي ديس اوردرز ولا سايكوباثي از ديس اوردر لانه
مم.
هذا نيد كلينيكال انترفيو
مم.
وبده لونج خلينا نسميها لونج بروسيس اوف اسسمنت اند ايفالويشن تو بي ديسايدد. لكن the traits we looking at the traits لما بنحكي high risk for personality سواء كان primary أو secondary ونقول high risk for personality or psychopathy personality trait means إنه في احتمالية for the development of psychopathy in the future if this person failed to manage his needs or psychological needs. الادابتيشن إشي مهم. Once they are not adapted to the situation in any way او at least promoted. انا عندي مصطلح مرات بحكي لهم انه the community may promote mental illness. ليش؟ by ignoring or masking. ignorance means انه معتبرها مش مشكله، والله طوشه صارت في الجامعه والطلاب ضربوا بعض. ليش؟ اختلفوا على قصه، بيركزوا على القصه وبينسوا طيب ليش الطلاب تهاوشوا؟ طب اثنين تهاوشوا ليش 50 واحد involved؟ طب ليش صار في تكسير؟ طب ليش استمرت المشكله 4 ايام؟ ما حد بيسال هذا السؤال، بيسالوا في هوشه. اثنين ماسك means انه بندور على اسباب اخرى بدل ما ندور على الاسباب الاساسيه الموجوده عند الشخص. So psychopathy personality trait is somehow خلينا نقول مقدمة for more or further psychological disturbances. قد لا تروح باتجاه psychopathy as a disorder or antisocial personality disorder، بس ممكن تروح باتجاه severe depression, severe anxiety or aggression in own manners اللي ممكن تكون بشكل أو بآخر. فكلامك صحيح دكتور وليد. احنا we are not talking about a disorder rather than we are discussing signs and symptoms or traits that may give a sign or speculation that this person might suffer from psychological or whatsoever.
هل يعني بالمقارنة مع دراسات in the community دراسات عالمية how does it compare؟
هلا الدراسة انتشرت حديثا. بقدر ابعتها عندك دكتور تشوفها كمان تشاركها مع الزملاء والاخوان. احنا طبعا قارنا بالارقام. عند الدراسات الغربية غالبا عندهم البرايمري سايكوباثي أعلى من السكندري. هم بيعانوا من نفس الفكرة إنه السكندري سايكوباثي not detected مقارنة بالبرايمري سايكوباثي. فهم عندهم البرايمري أعلى والأرقام أعلى. إحنا عندنا طلعت الأرقام تاعت السكندري أعلى. وطبعا السبب إنه ثقافة الأجريشن أو الأنجر عندنا في ثقافتنا فيها نوع من البرايد. يعني الميلز والفيميلز ما عنده مشكله يقول لك اذا واحد حاول يعتدي علي بعتدي عليه وبضربه. ما في حالة الكومبرومايزيشن الموجودة عند الثقافات الأخرى. يعني you compromise your life with anger. لا، هنا we do not compromise our life with anger. فمقارنة بالدراسات الغربية أرقامنا شوي أعلى في السكندري سايكوباثي، أقل في البرايمري سايكوباثي. ال 1.6% اللي أجت في الهاي ريسك فور سكندري سايكوباثي برضو كمان هاي الرقم مش موجود عند الدراسات الغربية مقارنة بالدراسات العربية. هذا الموضوع كمان أصلا مش متطرق له في الدراسات كثير. عدد قليل من الدراسات موجودة حول العالم اللي بتحكي إنه إحنا بدنا نركز على فئة الطلاب اللي هم نون كلينيكال سامبل. معظم الدراسات الغربية ركزت على الكلينيكال سامبل او على سبيسيفيك جروب، زي مثلا الجوفينايلز، بريزنز، او victims of torture، او الى اخره. يعني في particular kind of antecedents that may lead for the development of such kind of disorder. لكن احنا اخذنا نون كلينيكال لانه بدنا نثبت انه حتى النون كلينيكال sample might have such kind of problem.
أستاذنا الدكتور نزار، تفضل.
شكرا جزيلا دكتور وليد، وشكرا الدكتور أستاذ أيمن على هذه الورقة الجميلة الجيدة. قبل كل شيء أعتذر، الكاميرا بتاعتي ما تمشي وياي مصابة ببرسوناليتي ديسوردر. الثاني نقطة هي الحقيقة مزحة، بس مزحة جميلة. بالإنجليزي من يكتبون فور اكزامبل جوردن ات ال، أنا اللي لاحظت أنه من ضمن 8 أو 7 من الأوثرز في 5 من آل أيمن منصور، العفو، حمدان منصور أو فشي من القبيل. اي،
حمدان
حمدان
منصور.
منصور. فأنا أقترح أنه يقولون هذه الدراسة هي من إنتاج آل
آل
حمدان
منصور.
منصور. أوكي،
بدك
هذه بس.
بدك الصراحة دكتور،
نعم.
أنا أحكي لك قصة الدراسة.
نعم.
الدراسة أنا أولادي بيدرسوا طب، وأحدهم خلص يعني، والبقية في الجامعة، ومنهم واحدة صيدلانية واثنين أطباء، وواحدة لا زالت طالبة. والموضوع كان actually family work، فكنا بنتناقش حول هاي الجزئية، وهي أنه هل فعليا ردود فعل طلاب الجامعة بكذا وكذا وكذا. الآن عيلة صحية كلها دكاترة وصيادلة، فكان لابد يكون في نقاش حول هذا الموضوع. It was more scientific. فأخذنا هذا الجانب فحكينا why not to do a study. يعني that was a discussion over the lunch،
هو
وتحول من discussion over the lunch إلى published study.
this is
which is
what I
actually something like I'm proud of.
this is
اللهم
what I
تذكر
thought.
من هذه العائلات البحثية يا
Yes,
رب.
this is what I thought. I thought that this family were discussing the idea, the sampling, the methods, the discussion,
Exactly.
everything over lunch. This is what I thought. That's why I started with this point. Now, the second point, I quite agree that one of the strengths of the study is the non-clinical students or non-clinical sampling of the students. And I quite agree that a lot of work was done on clinical sampling, but in this case it was non-clinical. However, I disagree with what you said. طبعا أتمنى أن يتسع صدرك لكل
لا أكيد أكيد دكتور.
أنت شخص باحث، فأني متأكد تقبل كل شيء.
أكيد.
You said that they are normal, healthy students. Well, in fact, they are not, because if they were normal and healthy, you wouldn't have discovered these things. مثل ما يقولون إخوان المصريين هاي البلاوي.
صحيح.
they were
assumed to be normal.
they were non-complaining students. تمام؟
Yes. صحيح.
The second thing is the sampling. Again, it was a convenience sampling and cross-sectional. You cannot generalize that because you are saying that it should be applied on other universities in general and so on. So it is difficult really to do that on a convenience sampling.
صحيح. وعشان هيك أنا حكيت إحنا we need larger multi-site study، وحتى ممكن إحنا to do that across country.
Exactly.
يعني
And
across countries in general.
And that takes me to another point, اللي هو it was your last point when you said that by this we might predict that those people will develop either psychopathy or other disorders. Well, how can you guess that? It is difficult to say that. I think one of the points, which was probably mentioned in your recommendation, is to do a prospective study, follow those students, follow them up after many years, and try to find out
Right.
if they are in the first year, then in the last year, in the fourth year, you might follow them up and study them again and find out whether they develop these conditions. Because presence of anxiety, depression, or anger is a general thing. It happens in many people, and not all of them will go to other major psychiatric disorders or major personality disorders. The other
صحيح.
point, yeah, the other
حتى
point,
دكتور يعني تعقيب على كلامك،
نعم.
انه احنا ممكن ناخذ larger sample سواء كان prospective or retrospective ونطلع ال odd ratio of those actually suffering of the same cluster of signs and symptoms ونشوف the probability of being diagnosed with one of the personality disorders including those كلهم، مش بس فقط السايكوباثي او الانتي سوشيال. We can go for borderline, الافويدنس، schizoid, schizotypal, narcissistic, whatsoever. And if we have larger sample and cross country بدنا huge data يعني نشتغل عليها بنطاق الاود ريشيو ونطلع الانسيدنس والريسكس سواء ريترو اور بروسبكتيفلي. هلا هذا بتطلب انه يكون في عندنا huge data set بتحدث عن ارقام كبيره بثاوزندز وتكون across countries، وهذا طبعا بده ايفورت، وان شاء الله بنسويه في يوم من الايام. لازم نعمل اشي زي هيك ان شاء الله.
بالرغم من ذلك السامبل تبعكم كبير 640 something.
Yes.
It's something to be proud of. Now, another point is I'm sure a lot of us conducted studies on samples online. They are not always dependable, especially university students.
Yes.
As you know, sometimes they just fill in the blanks and make it as a game and as a joke. Therefore, really, this is one of the problems with these kind of studies, especially in our societies and in our cultures. We are still far away from having students who are mature enough to fill in the forms in a very sort of practical and responsible way.
حلو. هو دكتور في بالنسبه للاونلاين في بعض السجستشن واحنا اشتغلنا عليها اللي هي الون واي، بحيث انه هي بيقدر يعبي فقط only once from one email. والشغله الثانيه كان في personal invitation through QR، هو اونلاين بس في سكاننج للكيو ار، فبالتالي we scan people through الكيو ار which means انه we trust in these students filled out the survey, but we do not know exactly whether their answers were actually true or not, which is one of the main limitations for cross-sectional or convenience sample or the online survey. أو حتى لو كان hard copy بيكون بنفس الطريقة. لكن we tried to ensure that every single person participating in the study filled out the survey once، وكان التايمينج required هو 3 scales بيطلع حوالي تقريبا 52 item، فكان الافريج time should be like 5 minutes. For those who filled out the survey in less than 3 minutes were excluded because we know that they cannot read all the sentences in 3 minutes. عشان هيك في كان التايمينج على الاونلاين سيرفي لحاله بيطلعه 3 minutes he's out.
One more point إذا تسمح لي is some of these traits إذا ممكن دوحة iPhone mute yourself please. Okay, thank you. The other point is some of these symptoms, or we could call them traits, are shared by other types of personality disorders. For example,
Sure.
borderline personality disorder and so on. So I'm not sure whether that was referred to at the paper or not. I'm not quite sure of that.
السكيل دكتور هو designed to measure these traits and valid tool that measures traits of psychopathy, primary or secondary, and it's valid, reliable tool tested across different kind of nations and samples. That's why we used that kind of tool. I can share it with you. You will like it. But I know that, and you know because you are a specialist in the field of psychiatry, that many of these personality disorders are sharing certain signs and symptoms that seems to be similar, لكن distinction of the cluster of sample هو اللي بيخلي إنه these are the symptoms for primary, these are the symptoms for secondary, this is more for psychopathy, this is more for antisocial or borderline. But yes, you're true. This is what you're saying is completely right. في بعض signs and symptoms could be confused with other personality disorders. True.
The last point, 10 seconds only, and then we will let Abdullah Sayadi, Dr. Abdullah Sayadi, to ask his question. He raised his hand. Is that psychopathy, as you correctly said, is culture context, I mean, culture related context. That's why the primary psychopathy was not very highly prevalent in your sample. It's because it's more in the Western culture than in the Eastern culture. Thank you again for this nice paper, and thank you, Dr. وليد, for giving me the chance to talk.
شكرا.
دكتور نزار، بس بحب أكد لك معلومة جديدة كمان، أو يعني إضافية على كلامك. إحنا درسنا سابقا alexithymia, expression of feeling, and we find out in the university students, well, high school students, they have low grade of alexithymia. They do not express their feelings. That's why that comes exactly with primary psychopathy بالكلام تبعنا. فالكالتشر بتلعب دور مهمة in how to express your feeling and which way is more promoted for the community.
Thank you very much. Thank you.
يعطيك العافية دكتور نزار.
الله يخليك.
دكتور عبد الله.
شكرا جزيلا دكتور وليد على إتاحة هذه الفرصة. شكرا جزيلا دكتور أيمن على هذه الدراسة الرائعة. كما ذلك شكرا جزيلا دكتور نزار أمين على لطفك. بالنسبة للملاحظات اللي حذكرها، هي ملاحظات ممكن كمان تفيد الناس اللي هم خارج المجال البحثي أو الناس اللي ممكن هي مقدمة على امتحان MRCP Psych بالذات بيبر بي. الملاحظة الأولى متعلقة في الستدي ديزاين. الستدي ديزاين طبعا هي كروس سيكشنال كما تفضل فيها الدكتور نزار. كمان من ناحية الكونفينينت سامبلينج. الكونفينينت سامبلينج هو نوع من أنواع النون probability سامبلينج، بمعنى هو لا يخضع على للاختيار العشوائي. فهي كمان من يعني الدراسة ممكن تتأثر نتائجها بحيث أنه بيكون في سيلف سيلكشن بايز. عادة الناس اللي بتعاني أكثر بتشارك أكثر في الدراسات، فهاي من الناحية اللي ممكن تأثر في نتائج الدراسة. فهي non probability sampling. ال probability sampling لا بيكون في مجال إنه نختار من قائمة على سبيل المثال بطريقة systematize بحيث إنه تعطينا نتيجة إلى حد ما، أو تعطينا sampling إلى حد ما ممثلة للعينة المستهدفة. النقطة الثانية راح أعلق عليها هي مسألة إنه السكس، إنه كانت الفيميل shows secondary psychopathy أكثر. فهي نقطة من الأشياء المهمة، إنه في فرق بين statistically significant and clinical significant. أحيانا ممكن يكون في إشي statistical significant لكن مش متفق فعليا مع الواقع، وهي فعليا ممكن نحن كمان كباحثين أو حتى كدارسين نلاحظ هاي الفروقات. وكمان حاب
دكتور بس أقاطعك بهاي الجزئية. هو هون أنا ركزت على جزئية إنه ممكن يكون statistically significant لكنه قد يكون non clinical significant. ليش؟ لأنه إحنا نطلع على الماجنتيود اوف افكت، يعني بلغة الستاتستكس نطلع على الافكت سايز. ففعلا بعض الأرقام ممكن تكون statistically significant لأنه إحنا عندنا شوي larger sample size أو large sample size that may reveal significant correlation، لكنها لا تعتمد على clinical significance of the study. فلذلك يعني اللي بيقرأ هيك دراسات بده ينتبه as a clinician قديش الأرقام اللي قدامي معطية. مثلا الجاد بتحدث عن 21 أو بأرقامنا السبعة، يعني من 1 ل7. لكن لما تقول لي مثلا الزيادة رقم واحد تفرق في سكيل من 1 ل7 إذا الفرق موجود على مستوى الواحد. لكن في سكيل مثلا زي برايمري سايكوباثي من أصل 44 يكون الزيادة 2، باجي بحكي لك لا that is not clinical significant although it is statistically significant. فشكرا دكتور عبد الله على الملاحظة. قطعتك عفوا أنا بس.
لا شكرا جزيلا.
شكرا جزيلا دكتور أيمن. كمان في بس ملاحظة أخيرة بعد إذنك دكتور وليد، هي من ناحية الفاريبلز. عندي بس سؤال دكتور أيمن، هل كانت normally distributed ولا لا؟ شكرا جزيلا.
طبعا دكتور، احنا we tested the assumptions للريجريشن اناليسيز، وهذا hierarchical regression analysis. hierarchical regression analysis. ف for sure we have to test for normality and linearity of the dependent و independent variable. يعني أنا كنت بتمنى إنه يكون في عندي مجال أكبر إنه يكون أقدر أعمل odd ratio، بس هي الفكرة إنه ما كنتش حابب أعمل cut off point على being primary or not primary، met or not met، عشان ما يكون odd ratio confusing to the readers. فأخذتها بمستوى السكيل not بمستوى الدايكوتومس. yes, they were normal distributed based on the assumptions of normality و based on the assumptions of linearity.
شكرا جزيلا. أي سؤال من الحضور؟ تعليق، سؤال، إضافة؟
في ملاحظات دكتور في المكتوب،
مهم.
في ناس كاتب في الشات يعني أشياء محرزة مهمة والله. حديث عن انه المتحدثين في مواقع التواصل الاجتماعي وبيعتبروا حالهم مختصين بالتنمية البشرية، بتحدثوا في كثير مواضيع زي هاي. فعليا هذا امر يعني طال الحديث عنه سيطول، لانه غالبا دكتور وليد بيعرف انه في كثير من الناس يفتي بغير علم. هو قارئ وليس بباحث ولا مهني، ولا يعتمد في قراءاته على دراسات، ولا يعتمد في قراءاته على حالات هو تعامل معها وعالجها بنفسه. فهي قراءات اكثر من يعني دائما بحكي انه وسائل التواصل الاجتماعي هم مجرد ريدرز، لكنهم مبدعين في القراءة، فيجتذبوا الناس باسلوب القراءة تبعهم.
والله
اما
صراحة
تأثيرهم
ليسوا
فهذا الله
مبدعين،
اعلم.
يعني كثير منهم. يعني ماذا تعني مختص بالتنمية البشرية؟ شو الجامعة عندك بتعطي درجة في التنمية البشرية؟ الجامعة
لايف
بدها
سكولز، لايف كوتشنج دكتور ها.
شو يعني شو الدراسة الجامعية اللي تؤهل الإنسان يطرح نفسه كمعالج و... وللأسف يعني هاي بدها حرب مضادة لمنع مثل هاي الأعمال اللي أنا بعتقد يعني تضر بمصلحة الناس أولا وأخيرا. يعني مع الأسف الشديد كثير من هالتسميات، خبير الصدمات، خبير المشاكل خبير، حتى أنا لا أعرف كيف يحصلوا على كلمة خبير. أنا لا أسمي نفسي خبير بشيء، وكل واحد عمل كلمتين صار خبير. سؤال من الدكتورة آية:
What do you mean by psychopathy as disorder؟
مهم.
هذا عندك دكتور وليد مش عندي.
نعم.
هذا
What do
إلك
you
مش
mean
إلي.
by personality as disorder and how does it differ from antisocial personality؟ لا، هو طبعا psychopathy هي التسمية القديمة. في التصنيف الحالي هي antisocial personality disorder. هلا اللي بيحكي عنه الدكتور أيمن يعني هو أقرب إلى التريتس من ما هو تشخيص لاضطراب شخصية. وبالتالي يعني البحث في الانتي سوشيال بيرسوناليتي موضوع جدا صعب، حتى إيجاد العينة صعب إلا تجدها في السجون وتكون أساسا ملوثة في السجون. لكن في دراسات علمية كثيرة أجريت في السجون، ويعني نتائجها مع الأسف ما كانت effective. فكثير في يعني الناس لم تعد تقوم بالكثير من الدراسات بعد التجربة الشهيرة اللي تحدى بها أحدهم البرلمان البريطاني، وقال إنه هو ممكن يفرغ السجون كلها من هؤلاء الناس. وبعد جهد كبير تم منحه مبلغ ضخم وأنشأ مبنى واستقبل مرضى الناس. وللأسف بعد 5 سنوات لم يتمكن من أن يقوم بأي شيء في له فعالية. في السؤال برضو عن آه، is it possible that secondary psychopathy being prevalent in this study is due to universities being highly dependent with regard to admission on grades only rather than interviews or certain screening tools. ركان بسل.
هلا هذا النقاش ما بدخل في إطار البيرسوناليتي تريتس، لأنه احنا فهمنا إنه البيرسوناليتي تريتس is not incidental. It's not built on incidents or events. يعني it does not come because of 1 or 2 years of exposure to a certain kind of life circumstances. فبالتالي we cannot consider أن psychopathy traits سواء كانت primary or secondary comes because of the university environment أو being loaded or إلى آخره. ولا based on admission on grades، لأنه تم قبول الطلاب على مستويات معينة أو تصنيفهم. فأصحاب المعدلات العالية راحوا علوم صحية وهندسية وإلى آخره، وأصحاب المعدلات الأقل شوي أو الإنسانية مقابل العلمية. ما في إشي بيحكي إنه ال personality traits is incidental. It's accumulative, starts from childhood. آه، وبالتالي exposure is not based on the incident, rather it is accumulative and developmental. فما اتوقع انه في اي شيء، ولا قرات انا في اي دراسات. طبعا ممكن يكون في دراسات انا ما قراتها، بس بحكي عن ما قرات انا وعلمت انه ما في شيء بربط السايكوباثي personality traits بشيء انسيدنتال.
شكرا جزيلا دكتور أيمن. شكرا لكم جميعا على الحضور والمشاركة. تصبحون على خير. نلتقي
يعطيك العافيه، شكرا
بلقاء
شكرا
قادم.
جزيلا لكم جميعا. السلام
شكرا.
عليكم.